I am a clinical nurse specialist for the heart failure program at Sutter Visiting Nurses in Hospice, which is in Emeryville, California. I'm also adjunct clinical and lecture faculty for the nursing department at Dominican University of California in San Rafael. It's just like if you look at it as a pediatric nurse and a gerontological nurse, it's the opposite spectrum of life. Dealing with people that are over the end part of their life cycle, and all the age-related changes that affect them that are not pathological, and those that are pathological, you deal with. I started out in healthcare as a Navy hospital corpsman in the 80s. Got out of the military and worked as a certified nursing assistant. I met the nurse that I was working for that was the manager there, was a male nurse, and he really encouraged me to go back to school and get my degree in nursing. Ended up working at in acute care. Found that I was dealing with and caring for a lot of geriatric patients, and never in a million years thought that I would want to work with that population when I was in nursing school. Loved the population, found that they were the most receptive to care, they really wanted to get well, and they had fewer barriers to getting the care that they needed. So it made my job easier. And they were very receptive to the educational component of being a nurse, which was what I loved. Typical day for me in the clinical setting is teaching the student who has that perspective of a geriatric person, because when you're 17, 18, 19, and 20, which is what a lot of these young adults are, there's a huge age gap between them and the patient that they're caring for, or in this case, the resident that they're caring for. And then also helping them to foster the independence of that person at whatever level they are, and to note changes in that level of functionality, and why it's important for us as nurses to help those residents maintain their functionality. In practice, my job is exactly the same, only I'm the advocate, and I'm the vessel of all that information. We do quite a bit of is we do a lot of case management, disease management, and also a lot of social work issues. Well, definitely you need to be a people person. Any time you want to become, you want to engage in allied health professions, or you want to do something that's socially related. Again, social is in the definition of allied health, really. So you have to be able to communicate with people well. You have to be able to listen well. And you have to be able to understand where the person that you're dealing with is coming from. Critical thinking skills are huge. To be a nurse, you need to be able to critically think. Anyone that goes into a profession that's predominantly dominated by one gender or the other will have some type of obstacles that they must overcome. For men, I think the first obstacle, if they want to become a nurse, they need to embrace the fact that it is a female-dominated profession at this point, understand the dynamics of that kind of work environment. A lot of the old textbooks would say the nurse is doing a certain skill, and then she would do, and that kind of environment kind of perpetuates the belief of the male student that they're an anomaly in the profession and not an inclusive part of it. I encourage men to go to, there's a website called the American Assembly of Men in Nursing, and find a mentor in your area that's a male. They need to find associations that help them deal with the issues that they'll encounter. I wish someone had told me the relevance of all the prerequisites that I was going to be doing, because I struggled with that. Personally, I could not figure out in while I was doing them, what the heck does this have to do with me being a nurse? It's not medically related. Like speech, public speaking is a perfect example of that. Why am I taking this course? A baccalaureate degree is a more well-rounded liberal arts degree, so you have to take, for the degree requirement, you have to take all these art classes and writing classes and things, because that's the degree that you decided to go for. And irrespective of the nursing part, it's the degree you want. I wish someone had articulated that to me, and I think it would have caused, I would have, I would have enjoyed the learning experience a little. There's a lot of changes that are happening. The dynamic of the um, older person meekly taking the advice of the nurse or nurse practitioner or physician, and no matter what they say, I will do what they say, is totally gone. um, this is a very tech savvy population. There's a lot of information on the internet, good or bad, right or wrong, it's out there. Um, as a nurse, you have to be able to know that that means that you have to be on your game. And um, so the population is much more intelligent. They seek out behavior. They seek out information. They don't rely on what you say is to be 100% true. They'll research it. There is a tsunami of patients that are coming into this population that are retiring. There's a call for more and more nurses that want to care for this population. Advanced practice degrees are becoming more and more preferred, even in the acute care setting. So what I would encourage everyone when in a baccalaureate program to always think that the there is that possibility that I will become a graduate student. Because if you think proactive, then you'll get all the things done that you want out of that education to achieve. And know the differences between a nurse practitioner and a clinical nurse specialist. One is specifically patient driven or focused, and the other one is population. So if you like dealing with patients, then become a nurse practitioner, because we need them. Um, if you like population focused, a clinical nurse specialist. So some of the advice that I give people is to look at the school that you're thinking of going to, make sure that they're accredited, make sure that they offer a well-rounded program that has um, a lot of clinical components to it, because the more you're in the clinical setting practicing the theory that you learn and the skills that you learn, the better you will be um, once you're finished with the degree. Once you get your degree, it's a lifelong thing. So you have to kind of know that going into it. To be a specific geriatric nurse, I think I would I would recommend that people volunteer in a facility that cares for this population, um, and to try to be open-minded about the population, and not, when you're in nursing school, try not to box yourself into believing that I want to be a pediatric nurse, and because you limit yourself, so you have to know all of this stuff to be a well-rounded nurse. Um, so just be open to the educational experience.